Treating spider bites and identifying them. Spiders. Are they all poisonous? Many of the spiders in America, numbering approximately 3,000, are not poisonous. As much as many spiders bite, their incisors are so weak or tiny to break the human skin. Spider bites could result in red wounds that itch and always heal in a week or slightly longer. If the spider succeeds in biting and inserting its poisonous venom, we can have severe health problems. Continue watching to find out more about spider bites, varieties of spiders and their bites, and treatment for spider bites. How spider bites look. It would be much easier to identify spider bites only if you had a chance to see it bit you, but would be close to impossible if you didn't see it. However, you will be able to notice the spider bite a number of hours later. Signs of spider bite: swelling of the bitten area, a welt which appear reddish, damage to the skin. Any symptoms troubling and accompanying the spider bite. Additional symptoms that could result from a spider bite are rash or itching. Bitten area and the surrounding gets painful. Cramping or painful muscle. Purplish or reddish blister. Producing a lot of sweat. Breathing challenges. Head pain, headache. Vomiting and nausea. Shudders. High temperature. Restlessness and anxiety. Rashes. Lymph gland swellings. HBP, high blood pressure. Bites from spiders heal after a long time as compared to bites from other kinds of insects and could affect the tissues of your skin. It's better to ensure that the area that bitten in kept clean to prevent infection. Home remedies for spider bites. You can successfully treat and manage spider bites from home for bites from non-venomous spiders. Do the following to treat spider bites from home. Place a pack of ice on the spider bite at least every 10 minutes. To reduce the swelling, raise the area. To manage itching, take Benadryl, diphenhydramine, and antihistamine. Use water and soap in cleaning the area so as to prevent infection. In case blisters occur in the bitten area, rub with antibiotic ointment. If the spider bite symptoms do not disappear after performing the steps above over time, please seek advice of your doctor. In case you suspect or notice that the spider bite was resulted by the species of spiders listed below, please seek medical help as soon as possible. Tarantula. Hobo spider. Brown recluse. Brazilian wandering spider. Black widow. Below is an explanation of the characteristics of these spiders, their hiding places and how they look. Tarantula spider, commonly found in the desert climate areas of southwestern states as well as to the east of the Mississippi River. They stay under the stones or logs, trunks of trees, and in the burrows or tunnels. It is easy to know the tarantulas through their looks. They are hairy with fangs that are visibly hanging down, and they are measuring between 3 to 5 inches in length. They aren't as aggressive, and the types of tarantulas in the US are not seen to be dangerous, and their bites are similar to the sting of bees. After the bites, the surrounding area appears red and warm. Tarantula's bite symptoms are itching, swelling, faster heartbeats, rash, breathing problems, puffiness of the eyelid, LBP, low blood pressure. Seek the help of a doctor or physician as soon if you are having the symptoms listed above. Hobo spider. They live and are found in the Northwest Pacific. They run so fast and do sit up on their long legs. Be very careful if you are sweeping the garage or doing window wells cleaning, because hobo spiders easily get irritated to attack when incited. They prefer to live in closets, at the back of furniture, and behind baseboards. It is very hard to notice hobo spider bites at the beginning, but after some 15 minutes you will notice numbness and pain in the bitten area. The area will begin to get reddened within an hour and then swell and get harder in another 8 hours. The hobo spider wound automatically turn black and produce some discharge 24 to 26 hours later. Additional hobo spider bite signs could include a purple or red blister at the ruptured area, oral or visual disruption, painful joints, general weakness, nausea, production of sweat, headaches. Bites from hobo spiders take quite some time to heal. Ensure you visit a doctor if you are suspicious of a hobo spider bites. Treatment for hobo spider bites is similar to the bites by brown recluse spider. The treatment could include surgery, antibiotics, and corticosteroids. It is preferred that the administration of the medication be done in less than 24 hours from the bite time. Brown recluse spider. It prefers to hide in secluded dark areas. It's not aggressive and measures approximately 1 inch long. It is also identified as violin spider because it has on its back dark marks. Brown recluse rarely bites unless it gets trapped on your skin. You are most likely to find the brown recluse spider in the following areas: Eastern Texas, Oklahoma, Louisiana, Arkansas, Kansas, Tennessee, Missouri. When you are bitten by brown recluse spider, it could feel painless, but you will start itching, hurting and turning red after 8 hours. A purple or red ring similar to a bull's eye or target starts to appear around the area of the bite. This spider bites can soar and progressively grow worse if not treated until it begins to destroy the tissues surrounding it, resulting in headache, cold and fever. In abnormal cases it may result in seizures or coma. Urine stained with blood. Jaundice. Failure of the kidney. There's no specific medication for treating brown recluse bites, you only ensure that the bitten area is maintained clean to hasten healing process. Visiting a physician may be of much help as he could advise on antibiotics after examination. In worse cases, you could be referred for hospitalization and surgery if the tissues around the bitten area are dead. Brazilian wandering spider. Found in the South and Central America, Brazilian wandering spider is very aggressive and dashes very fast. It can reach a maximum length of 5 inches. It is among the world's most poisonous and dangerous spider. Its bite is terribly painful and can quickly degenerate to heavy drooling and sweating within minutes. The bitten area and the surroundings immediately become hot, reddened and swollen, and in extreme cases the Brazilian wandering spider bite can cause tissues to die and tragic. The good news is that an anti-venom is readily available for managing the Brazilian wandering spider's venom. Black widow spider. It is black and shiny and has a distinctive hourglass-shaped reddish mark under its belly. Commonly found in western and southern U.S., the black widow spider lives comfortably in the lone areas of woodpiles, attic boxes and in the fallen leaves piles. You need to understand that female black widow is lethal and very toxic. You will not realize a black widow bite as it's more like prick from a small pin and the reaction of the skin is almost instant. You can identify 2 rapture marks at the bitten spot on the skin. Bites from black widow spider will show the following signs: cramping of muscles, inflammation and pain at the rapture bite, excessive sweating and saliva, vomiting and nausea, headache, anxiety, coldness at the spot. Seek immediate medical help from a doctor for both adults and children. A doctor may choose to administer anti-venom to eliminate from your body the black widow's poison. Wolf spider. They measure between 3 and 4 inches and are very analogous to tarantulas. However, wolf spiders are found all of United States and they are prey stalkers and do most of their hunting while they stroll on the ground. Mainly they live in the sand, door bases, and windows, as well as in plants within the house or on gravel. They have within the center of their faces 2 big eyes alongside 6 other eyes which are smaller in size. Spider bites occasioned by wolf spiders could break the skin and are usually painful. They do cause swelling, redness and pain and could result in your lymph nodes swellings as your body fights off the venom. The healing process for wolf spider bites may last up to 10 days in some people, but it may also result in damage to tissues surrounding the bite area. Camel spider. The camel spider resides within the desert climate. It has a pincer which is highly powerful on its head and it looks like sand in color. It prefers to hide in the cool environment in the surrounding and could even consider your shadow. Although it only measures up to 3 inches but can reach between 6 and 8 length inches in other places, it is extremely fast with a speed of approximately 10 miles per hour. It is however very deadly as it has big wide fangs which can result in extremely pronounced wound. Spider bites that are caused by camel do not release venom to the human skin but is likely to result into infection. The bitten area may swell and bleed at the same time. Jumping spider. It commonly lives in the homes all over American states. Its body structure is hairy and stout and it measures up to 1/2 inch. It has spots of white over black body color and its form of movement is similar to jumps. Normally you will notice it in vegetation within the garden. Spider bites from jumping spiders is comparable to stings of wasps and can only be dangerous if your system is allergic to venom of spiders. Severe signs include reddened area, pain occasioned by the bite, mild swelling, itching, mild headache. They rarely attack, but when agitate they will no doubt bite. Wear gloves while operating in the garden. Time to see a doctor. In extreme cases, spider bites may make an individual develop difficulty breathing or complete shock on their bodies. Ensure you get help of a doctor if the symptoms persist longer. Your doctor could recommend a jab for tetanus if your immunization records are not up to date, but to be sure of your safety, ensure you get treated in less than 24 hours of spider bites.